The pandemic nursing shortage has impacted our everyday care at hospitals, but it really exacerbated the issues of already understaffed systems within Cleveland's healthcare. Our State House reporter Morgan Trow is in the Capitol with an update to federal legislation that would help this essential team.
Survivors of sexual assault face uphill and traumatic battles. But a lesser-known struggle is what happens to them when a medical team gathers evidence of the assault.
Because if a nurse isn't available for 6 hours, well, then a nurse isn't available for 6 hours.
Cleveland Clinic Chair of OBGYN Dr. Jennifer Savitsky is seeing the pandemic staffing shortage has already reluctant survivors rethinking getting the medical care they need. Her team in university hospitals say sexual assault exams can take up to 6 hours to conduct. But some survivors in rural areas are now sitting for numerous hours before they are even taken back from the waiting room.
In the state of Ohio, we only have 28 certified pediatric sexual assault nurse examiners.
Rainbow Sexual Assault Nurse Examiner, or SANE nurse, Kathleen Hackett is one of 2 SANE certified pediatric nurses at the hospital.
We just don't have the financial support.
A 2016 government study shows there is a critical shortage of SANEs for 3 main reasons. Not enough training programs, limited money for training, and trained nurses are leaving the profession because of stress and low pay.
The Cleveland Clinic says it's seen a 75% decrease in funding since federal bills like the Violence Against Women Act expired in 2019. But new bipartisan legislation like this one aims to pump money into those SANE programs.
It's important that in our communities we have these nurses available and on call.
The Supporting Access to Nurse Exams, or SANE Act, is a bipartisan bill introduced by Congressman Dave Joyce of Ohio and Congresswoman Deborah Ross of North Carolina. The act is an update to an existing federal grant program, but this bill is dedicated to the training, recruitment, and retention of sexual assault nurse examiners like Hackett.
That's going to give those people, those survivors, the courage to actually come to the hospital.
If passed, the act would take effect in 2023. In Columbus, Morgan Trow, News 5.
Okay, so we want to give you a closer look here at what kind of training it takes for a nurse to become a sexual assault nurse examiner. A SANE nurse is considered a type of forensic nurse. They need specialized training to work with patients who have experienced sexual assault, abuse, or incest so they can collect forensic evidence, provide emotional support, and connect patients to legal aid and advocacy groups.